Hello everyone. So welcome back to the channel. Today I am there with a very common disease in India. Being a tropical country, we have rheumatic involvement of the cardiac valve very commonly in our country. So today we had this patient hailing from central India who presented to us with history of palpitations, with a history of breathlessness on exertion, and subsequently when I did his echocardiography, I got that his mitral valve, his tricuspid valve, and even his aortic valve is involved by the rheumatic heart involvement. So let us see directly the echo features of how rheumatic heart disease looks like. So I would like to show you some of the images that I have got in this patient. So let us directly start with the scanning process of this patient. So on scanning these patients, see clearly, we can see that the mitral valve is becoming like a hockey stick. I will explain on the image also. I will pause the video. This is our mitral valve. This is our mitral valve. This is called the anterior mitral leaflet. This is called the posterior mitral leaflet. If you pay attention, this anterior mitral leaflet is gaining a shape of a hockey stick, which is very characteristic of rheumatic mitral stenosis. If you want for a comparison, I have one patient's echocardiography which is of a normal mitral valve, and this is the image. This is how a normal mitral valve looks like when the heart beats along with the normal aortic valve. But if now you compare with this patient's echocardiography, you can see that the mitral valve is becoming hockey shaped when it is beating, and this is a classical sign of rheumatic heart involvement. In addition, if you pay attention to the aortic valve, this is also thickened and it appears that it is getting a more whitish in color on echocardiography. Coming to the short axis view, see, this is the classical fish mouth appearance of a thickened mitral valve. You can see that the mitral valve has become very thick with a small slit-like opening. The normal area of the mitral valve should be around 4 to 6 centimeter squares. This patient has a mitral valve area of around 0.8 centimeter square. So this is very much reduced. Coming to see the complications of mitral stenosis, we should not forget that mitral stenosis commonly presents with blood clot inside the heart because the blood supply of the atrium decreases. So this is the area which is called as the left atrial appendage. This is the left atrium. So blood starts getting stagnated inside the left atrium, and because of this stagnation, blood starts getting clotted. So this finger-like projection is called as the left atrial appendage, and this is a very famous place for blood to get clotted, and the patient may then have complications like brain stroke and all. Similarly, this is the whole picture of the patient's heart. These two are called as the atria and these two are called as the ventricles. This is the left ventricle, left atria and the right atria. You see how the tricuspid valve is beating. It is thickened, not beating properly, getting stenosed. The blood supply through the mitral valve has decreased. And when we put color in this, see, I have labeled this for you all. This appearance is classically called as the candle flame appearance of mitral stenosis. Blood is going from the left atrium to the left ventricle with a candle flame configuration. In addition to this, when I saw the patient's echocardiography in detail on the right side, even his right side valve, which is called as the tricuspid valve, is stenosed and it is leaking as well. So blood is not passing properly from atria to the ventricles, as well as all the blood is coming back in the atria when the heart is beating. So this is a complicated mitral valve involvement, valvular disease involvement with multivalvular involvement. Also, this is the aortic valve that we saw in the beginning of the lecture. This is a left-sided valve from which blood comes out and gets distributed throughout the body. You can see this turbulence. It clearly indicates that the blood here is not able to pass properly and there is a jam, just like traffic jam at the aortic valve level, and blood is also leaking back into the heart instead of going ahead to be supplied to whole of the body. So this is a multivalvular rheumatic heart disease involvement, and also because of all these changes, the patient has landed up in cardiac failure. This is the inferior vena cava that brings the blood from whole body to the heart. This is dilated without any collapse. So it indicates that the patient is also in cardiac failure. We have started diuretic therapy for this patient, and possibly this patient will get well soon, but yes, he definitely would require surgical intervention. And this is the classical bicable view where you can see the right atrium, the superior vena cava and the inferior vena cava together in a single frame. This is the left atrium and this is the interatrial septum that separates the two sides of the heart. So this was a very classical case of mitral valve involvement at multivalvular levels, and it was very essential that I should enlighten or focus light on such common disease which is very common in our country. And sooner after the patient is stable, we will plan this patient for a proper multivalvular heart surgery. I hope this lecture proves useful to everyone who is listening to this lecture. Thank you so much for your kind attention.